today, I thought it was really important that we really understood in a deep way the significance. So you will see on this slide, and I'm not going to pause so long on every slide, you will see that we have the ability to shape where the peak of this epidemic is. And you can see the purple line, and then you can see the shade of where it could be, and to where we could flatten it in the range that is provided. And it shows you the numbers in the United States in terms of the shortage of beds and the shortage of ICU beds. Moving to the next slide, we have here sort of zooming into the resources when we peak. Right now, it's predicted by this statistical model to peak on April 15th. You can see the numbers that are anticipated. Moving to the next slide. This particular website also shows us the number of projected deaths per day. Moving to the next slide. And you can see, zooming into April 15th, that the predicted number of deaths per day is 2,214. But below that, you see the range, which shows us that we have the ability to bring it down to as low as 1,106. So that range is a very important concept that we need to focus on. And moving to the next slide, you see the total number of deaths as per by a certain date. So you can see by August 4th, they're anticipating, projecting by this model, over 83,000 deaths, COVID-19 deaths. Moving to the next slide. And then if you were to zoom in on April 15th, you can see again the total number of deaths projected by this model. Now I'm going to go ahead and move through the remaining slides where the same set of slides are focused on California. In California, however, we had a stay-at-home order that kicked in on March 19th. And you had educational facilities closed by March 19th. And those measures that were taken in California has played a significant role in the spread of the epidemic and flattening the curve. I'm not going to spend time on each of these slides, but I'll have you, Shannon, go on to the next slide. You will see here the resources in California. To the next slide, it captures the same deaths per day, and California is supposed to peak. Today, it's supposed to peak on April 27th. Moving to the next slide, again, we're zooming into April 27th as the predicted date that is modeled today. It might shift tomorrow. So go back, it's a very dynamic model. And here you see the total number of deaths in California by this model. Next slide. And I think that's the last slide I have on the new metric that I've started following. So moving to the next slide, you can see that Bakersfield, the city of Bakersfield announced closure of all city playground areas. And I saw that this morning when I went for my morning walk at 5:30 with Neo and Bessie. The playground in the park close to my house, the swings were being secured so kids could not use it. Moving to the next slide. So staying at home, sheltering in place is not something new that we've been messaging from Bakersfield College leadership. To that message of staying at home, I'm including try to keep a healthy lifestyle to make sure you sleep well, you eat right, you exercise, and stay as positive as you can, because a healthy lifestyle really helps keep your immune system strong. What is starting to emerge in the national dialogue, both in the forums that are conducted by Dr. Anthony Fauci and the new CDC deliberations, they seem to start thinking about whether we should be covering our faces. Please note that they're very clear about non-medical face cover because they don't want individuals to be running off and buying the surgical or the medical face masks, because we have a huge shortage of those masks. And in fact, my daughter, who is a surgeon, has been giving me, she's on the front lines, and she's been telling me how they have a protocol in prioritizing who uses the mask in the hospital setting. So we need to be really smart about this. But I wanted to, since BC is always ahead of the curve in keeping track of what is happening so that we can plan, I've sort of added that to my advisory going out to BC's faculty, staff, and students. We've been using the phrase that BC has been ahead of the curve, and you, my dear students, have certainly felt it, because we started massively moving our online classes over 3 weeks ago, and we were one of the first colleges to move completely online, both from an instructional and a student affairs perspective. So we were ahead of the curve when in January, we sent out our first advisory when there were only over 9,000 cases worldwide. We kind of felt that this novel coronavirus needed to be followed and monitored carefully. And you can see by the different dates, as things were unfolding with the World Health Organization and other organizations, both nationally and globally, BC was systematically taking steps. We released our all-campus video on March 2nd. We activated the Incident Command Center late February. We started canceling travel and large gatherings in early March. And then by March 12th, we had moved completely all of our instruction and student affairs. And I'm truly looking forward to hearing from you, renegades, how this massive shift in your learning environment is treating you and what words of wisdom you have for your classmates. So this slide, I continue to chronicle the work that BC has been doing over the last week. And last week, there were two particular programs that I'm very, very proud of. And the first one, our nursing students, under the leadership of Director, our Associate Dean, Carla Gard, she was able to get 69 of our students placed on the front lines with KMC, with the Bakersfield Heart Hospital, and Dignity Health to help out in this time of crisis. Your classmates, your fellow renegades on the front line. So a big thank you to the faculty, a tremendous thank you to our students, and a big thank you to Carla Gard. We also have launched a program called Back to College because, as you know, we are facing unemployment rates that are unprecedented, just large numbers. So moving to the next slide, I have some news items. Next slide, Shannon, after this one. News items that indicate the unemployment that has been, that we have been both nationally and in our state facing. So during unemployment, where do people turn? They turn to colleges and universities because they think of this as an opportunity to pick up a degree or a certificate. So moving to the next slide, we have a Back to College program that we launched on March 25th, and we had a first cohort of students who were, actually what we launched on March 30th were the advisory programs for the students to register for the classes, but the actual program was launched on March 25th. So you can see the set of classes. We have, it's a 5-week semester starting, classes start on April 13th and it runs until May 15th. Moving on to the next slide. Those are some ways in which you can get financial aid counseling and counseling to get your student ed plan done for this 5-week semester. Next slide. So we will not be having a program tomorrow, so tune back in on Thursday for the next virtual forum at 3 p.m. And now I would love to hear from our student panel, Karen, Gian, Emma, and Maria. Let's get started.